Welcome back to our channel focused on health and wellness. Today, we're diving into a critical topic that concerns many of us: the impact of medications on kidney health. Our kidneys play a crucial role in filtering out toxins and maintaining our body's balance. However, certain medications can pose serious risks to these vital organs. Here are 7 common medications that can harm your kidneys. As we age, our kidneys become less efficient, making it essential to be mindful of what we consume. Many medications, while beneficial in treating various conditions, can silently impair kidney function over time. Understanding these risks is crucial, especially as kidney function naturally declines with age. Drug-induced nephrotoxicity can range from mild dysfunction to severe complications like renal failure. The impact varies from person to person, making it essential to tailor medication choices to individual health needs. In our upcoming video, we'll explore strategies to safeguard your kidneys while effectively managing medical conditions. In this video, we'll explore the impact of common medications on kidney health and provide practical tips for managing these drugs safely. Remember, understanding the risks associated with them can empower you to make informed decisions about your health care. Stay tuned and learn how to protect your kidneys while effectively treating other medical conditions. Remember, protecting your kidneys today ensures a healthier tomorrow. Number 1. Antibiotics. Antibiotics are powerful medications designed to treat bacterial infections by either killing bacteria or inhibiting their growth. While they are crucial in combating bacterial diseases, their impact on kidney health can be significant. Certain antibiotics, such as aminoglycosides, vancomycin, and some beta-lactam antibiotics, have been associated with nephrotoxicity, which means they can cause direct harm to the kidneys. This damage occurs because these antibiotics can accumulate in renal tissue, leading to cellular toxicity and impairing the kidney's ability to filter waste from the blood. Nephrotoxicity can manifest as acute kidney injury, AKI, characterized by a sudden decline in kidney function. This risk is heightened in individuals with pre-existing kidney conditions, elderly patients, and those taking other nephrotoxic drugs. Additionally, dehydration and improper dosing can exacerbate the harmful effects of these antibiotics. Symptoms of antibiotic-induced kidney damage include decreased urine output, swelling, fatigue, and elevated blood pressure. If prescribed improperly, you might experience side effects like diarrhea and liver and kidney problems. Even when used correctly, certain antibiotics like polymyxins, aminoglycosides, and vancomycin can harm your kidneys. Simply put, your kidneys play a crucial role in removing antibiotics and other drugs from your body. Did you know that nearly 1/3 of antibiotics prescribed in the United States aren't even appropriate for the conditions being treated? That's according to a report from the Centers for Disease Control and Prevention, CDC, and a study published in the Journal of the American Medical Association. Before you ask for an antibiotic or if your doctor prescribes one, it's important to know which conditions they can treat. You can ask them, "Is this necessary?" Most doctors will gladly explain why it's needed. If antibiotics are truly needed, follow the dosage exactly as instructed and adhere to any food requirements. This ensures the medication is effective and helps protect your kidney health. Number 2. Non-steroidal anti-inflammatory drugs, or NSAIDs in short. In fact, NSAIDs are very common. Over 30 million people take them daily. NSAIDs are commonly used to ease headaches, sprains and strains, colds and flu. Non-steroidal anti-inflammatory drugs, NSAIDs, are a widely used class of medications that include common drugs such as ibuprofen, Advil, Motrin, naproxen, Aleve, and aspirin. These medications are effective at reducing pain, inflammation, and fever by inhibiting the enzymes COX-1 and COX-2, which are responsible for the production of prostaglandins. Prostaglandins play a crucial role in inflammation and pain signaling, so reducing their levels can provide significant symptom relief. However, NSAIDs can pose risks to kidney health. By inhibiting prostaglandins, NSAIDs reduce blood flow to the kidneys, potentially leading to conditions such as acute kidney injury, AKI, which can occur even with short-term use. Prolonged use of NSAIDs has been linked to chronic kidney disease, CKD, a progressive condition that can ultimately lead to end-stage renal disease, ESRD. Additionally, NSAIDs can cause electrolyte imbalances, further stressing the kidneys. Those most at risk include the elderly, individuals with pre-existing kidney conditions, and those who are dehydrated. Each year, approximately 500,000 to 2.5 million people suffer kidney injury due to NSAIDs. Even more concerning is that these drugs frequently lead to hospital admissions because of adverse drug events, some of which can be fatal. A 2006 study published in the Journal of the American Society of Nephrology analyzed data from over 10,184 individuals prescribed NSAIDs for various conditions. The study revealed that NSAID use increased the risk of acute kidney injury by 26%, especially within the first 30 days of use. This finding highlights the need for caution when prescribing and using these medications. In another study, scientists examined 99 patients with chronic musculoskeletal pain who took NSAIDs for 12 months. They found that most patients experienced a decline in kidney function after NSAID use, but their kidney function returned to normal after switching to a different pain reliever. Understanding these risks helps in making informed decisions about NSAID use and in protecting kidney health. Number 3. Antiviral drugs. Antiviral drugs are medications designed to target viral infections by disrupting specific stages of the viral life cycle, such as viral replication or assembly. While they are essential for treating viral illnesses like HIV, hepatitis B and C, influenza, and herpes, some antiviral drugs can adversely affect kidney function. One example is tenofovir, a widely used antiretroviral drug for the treatment of HIV. Tenofovir disoproxil fumarate, TDF, and tenofovir alafenamide, TAF, are two formulations of tenofovir. TDF has been associated with nephrotoxicity, primarily causing proximal renal tubular dysfunction and, in some cases, acute kidney injury. This nephrotoxic effect can manifest as increased serum creatinine levels, decreased kidney function, and proteinuria, protein in the urine. Another example is acyclovir, an antiviral drug used to treat infections caused by herpes viruses, including herpes simplex virus, HSV, and varicella zoster virus, VZV. Acyclovir can lead to crystalline nephropathy when high doses are administered or when there is inadequate hydration. Crystalline nephropathy occurs due to the precipitation of acyclovir crystals in the renal tubules, which can cause kidney damage if not managed promptly. Real-world examples of antiviral-induced kidney damage emphasize the importance of monitoring kidney function regularly during antiviral therapy. Now, the next set of drugs on our list might surprise you because they're typically considered pretty good for your kidneys. Number 4. Diuretics. Diuretics, commonly known as water pills. Diuretics function by increasing urine production, facilitating the expulsion of excess salt and water from the body through urine, which can aid in managing hypertension, a significant risk factor for kidney disease. Therefore, diuretics are generally considered beneficial for kidney health. However, despite their overall benefits, diuretics carry risks, particularly concerning kidney function. Unlike NSAIDs, which can directly harm the kidneys or affect their filtration capability, diuretics impact the kidney's processes further downstream. They alter urine concentration and electrolyte levels, thereby increasing urine output. Nevertheless, excessive use or high doses of diuretics can lead to dehydration, which poses a risk factor for kidney damage. It's important to use diuretics judiciously and under medical supervision to mitigate these risks and maintain kidney health. While effective in reducing fluid overload, furosemide can cause electrolyte imbalances and dehydration, both of which can adversely affect kidney function. For instance, in patients with heart failure, the overuse of diuretics can lead to a state of dehydration and reduced blood flow to the kidneys, exacerbating kidney dysfunction. This scenario underscores the importance of regular monitoring of kidney function and electrolytes in patients on diuretic therapy. Number 5. ACE inhibitors and ARBs. ACE inhibitors, angiotensin-converting enzyme inhibitors, and ARBs, angiotensin II receptor blockers, are two classes of medications commonly used to treat hypertension, high blood pressure, and other cardiovascular conditions. While they are generally well tolerated and effective, both ACE inhibitors and ARBs can have notable effects on kidney function. ACE inhibitors such as enalapril, lisinopril, and ramipril work by blocking the conversion of angiotensin I to angiotensin II, a potent vasoconstrictor. By doing so, they help relax blood vessels, reduce blood pressure, and decrease the workload on the heart. This action also promotes blood flow to the kidneys and may help protect kidney function in patients with hypertension or diabetes. Similarly, ARBs like losartan, valsartan, and irbesartan block the action of angiotensin II by binding to its receptors on blood vessels, effectively lowering blood pressure. ARBs are often used as an alternative to ACE inhibitors, particularly in patients who cannot tolerate ACE inhibitors due to cough or other side effects. While ACE inhibitors and ARBs are beneficial for kidney health overall, they can also affect kidney function in certain situations. Number 6. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, are medications commonly prescribed to reduce stomach acid production, thereby alleviating symptoms of acid-related disorders such as gastroesophageal reflux disease, GERD, peptic ulcers, and gastritis. While PPIs are highly effective in managing these conditions, they can have implications for kidney health. Prolonged use or high doses of PPIs have been associated with nephrotoxicity, particularly in vulnerable populations such as older adults and those with pre-existing kidney disease. Chronic kidney disease, CKD, acute interstitial nephritis, AIN, and acute kidney injury, AKI, have been reported in some cases linked to PPI use. These conditions may manifest as decreased kidney function, increased serum creatinine levels, and electrolyte imbalances. A real-world example involves a study published in the Journal of the American Society of Nephrology, which found an association between long-term PPI use and a higher risk of CKD. The study highlighted the importance of weighing the benefits of PPI therapy against potential risks to kidney health, especially in patients requiring long-term acid suppression. Number 7. Antidepressants. Antidepressants are medications primarily prescribed to treat depression and other mood disorders by altering neurotransmitter levels in the brain. While they are beneficial for mental health, certain antidepressants can impact kidney function, especially when used long-term or in high doses. One example is lithium, a mood stabilizer commonly used to treat bipolar disorder. Lithium is known to affect renal function by causing nephrogenic diabetes insipidus, a condition where the kidneys are unable to concentrate urine properly. Prolonged use of lithium can lead to chronic kidney disease, CKD, and irreversible kidney damage in some individuals. Another example includes selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, such as fluoxetine, Prozac, and venlafaxine, Effexor. While these antidepressants are generally considered safer in terms of kidney function compared to lithium, they may still cause adverse effects. For instance, SSRIs and SNRIs can occasionally lead to hyponatremia, low sodium levels, which can affect kidney function if severe or left untreated. Real-world examples illustrate the potential impact of antidepressants on kidney health. Studies have shown that long-term use of certain antidepressants, particularly lithium, requires regular monitoring of kidney function through blood tests to detect early signs of kidney impairment. If you are taking any of the medications that have been discussed in this video, check your kidney function regularly using tests that include blood creatinine levels, glomerular filtration rate, or GFR in short, and urine tests for protein. Proper hydration helps your kidneys clear sodium, urea, and toxins from the body, which can mitigate the impact of nephrotoxic drugs. Whether it's diuretics, proton pump inhibitors, or antidepressants, each type of medication can affect kidneys differently. By staying informed and working closely with healthcare providers, you can make informed decisions about your health. If you found this information valuable, please consider subscribing to our channel for more insightful content. Don't forget to share this video with others who may benefit from learning about kidney health and medication impacts. Together, we can promote awareness and better manage our health. Thank you for watching.